Welcome, Renee.
Hello, I tell you. Like that I could think wasn't on my calendar. I'm like, wow. Okay, it's all
Listen,
good.
we're just glad you're here.
Thank you.
All right, we're going to go ahead and get started. Good morning, everyone, especially to the folks that have joined on the panel today. We've got Greg Kesterman, Hamilton County Health Commissioner, and Renee Mahaffey-Harris, President and CEO of Closing the Health Gap. Welcome to both of you. Thank you for being on. And of course, Bridget Doherty is helping to moderate. As always, I'm going to run through the numbers here real quick. The number of positive cases in Hamilton County is up to 183,421. The number of hospitalizations is up to 5,604, and the number of deaths in Hamilton County is up to 1,847. The week over to week increases for positive cases is just over 2,000. For hospitalizations, it's 129, and for deaths, it's 31. So as you can tell, the number of positive cases has gone down significantly. The number of hospitalizations is still very high, and the number of deaths is still pretty high. I know it's hard to kind of track these. I've got a sheet. Here's my sheet. This is how I track the week over week. I didn't expect to do it this long. As you can tell, I'm running out of room at the bottom of the page. But as I track these numbers, the positive cases, they're high compared to where we were, a while back, like a year ago, but not high compared to where we've been in the last couple of months. Or rather month or weeks rather. I just want to put that in perspective. I know Greg Kesterman's always saying this, but our numbers are trending down, but the numbers are still very high. And especially when it comes to the hospitalization and death numbers. So not quite out of the woods yet. So just a little bit of a cautionary note as we look at positive trends going into today's conversation. Renee Mahaffey-Harris is going to talk about some of the challenges that we face reaching communities that are just hard to reach, whether it's through communications or sending out mobile units to make sure that people have the opportunity to get vaccinated or tested. There are many things that go into the work that Renee and her team are doing, but she has backed up what we are learning through data. And I think it's really important that we understand through the lens of data what is happening and who we still need to focus on related to our efforts to make sure the community remains safe. Before we get started though, there has been a lot of buzz this week about the Super Bowl. I have a pen and I'm going to go get it and stick it up here. But I do want to mention, and there have been press conferences about this with this information, but for those that haven't tuned in yet related to what's going on in Cincinnati and in Hamilton County, Visit Cincy is the place to go for game day events. It will detail for you what's happening at the banks, what's happening on Fountain Square, what's happening at Findlay Market. There are many, many places throughout the county that are hosting Super Bowl parties. Many of our local merchants, our bar owners, our restaurant owners, I don't know anyone that's not in the spirit for this game. So it's super exciting. Hooday, but go to Visit Cincy and you'll find all these events. And if you're still looking for something to do on Super Bowl Sunday, we've got something for you, no matter who you are and how you like to celebrate. And one other quick note, a while back, we discussed an arts grant that has been put out by the county for arts organizations that really suffered during the pandemic and are still struggling to get back to normal. They're not back to normal. And so we released money from our American Rescue Plan dollars. In addition to the rent assistance, the mortgage assistance, the small business assistance, we had an arts grant that went out as well. The deadline for arts community partners to apply for that is February 15th. And for those that need that information, it's a 513 relief. Jump on there. You can easily apply for those dollars if you're an arts organization that has really been challenged and struggled through COVID. So that is the end of my announcements. I'm going to run and get my banner, not to ignore you, Greg, but I forgot to put my pen in up, so I'm going to go get it. So I'm going to turn it over to you.
Sounds great. Thanks, Commissioner. Well, good morning, everyone. Commissioner Driehaus kind of set the tone. Things are in many ways heading in the right direction. So let's get started with how many active cases we have here in Hamilton County. We are at 16,000 active cases of COVID-19. And for perspective, just 1 week ago, we were at 31,000. So certainly the right direction. Looking at our 7-day average, our last peak was January 16th. We were at 2,470 cases per day, clearly higher than at any other point in this pandemic. Today, we are at 309 cases per day, so a drastic drop off over the last week. A little bit of a time lapse. This is January 7th. The entire county, you can see, is extremely impacted by COVID-19. A few weeks later, you can start to see some of that relief on January 26th. And then just a couple days ago, you can really see the map take a new tone and show that relief. So we are really seeing a lot less cases, although I hope this map still implores that there is COVID in our community and we must continue to have some caution. Keep sick at home. If you wake up on Sunday and you're feeling ill, enjoy the Super Bowl from the comfort of your own home. Don't go around other people and make folks sick. The reproductive value this morning is at 0.56, and for the region, we are at 0.58. And our percent positivity for the region continues to plummet. We are at 16.4% for the region and just below that for Hamilton County. The bottom half of this graph is also testing numbers for our region. And you can see the demand for testing as people are feeling better has drastically decreased over the last several weeks. Hospitalizations continue also to decline at a rapid number, although I think it's still worth pointing out that 616 individuals within our hospital systems is still a very high number for our community. So our hospitals are still being impacted. Our physicians, our nurses, and our care teams are certainly still exhausted from the last couple months of COVID activity. So please continue to keep them in your thoughts as you are out in our community and work together as a community to help lower the impact and burden for this hospital systems. Those within the ICU, we are at 130 individuals within the ICU and 101 individuals on ventilators. As I've shared in this format before, once you're in the ICU, the prognosis is not great. Only about 1 out of 2 people make it out of the ICU. So on the next slide, I showed deaths, and you can see over the last couple of weeks, we have had a significant increase in deaths over the last couple months compared with where we were at in the summer. You can see many days have jumped well above 5 deaths per day. And so this pandemic continues to have an impact on our community, and I think it's important to remember that. As far as the Centers for Disease Control, the entire state of Ohio remains high transmission, although it is dropping rapidly. Hamilton County, also high transmission. We are at 281 cases per 100,000, and our percent positivity, as mentioned, is at 14.67. We continue to be in our communities vaccinating. All of Hamilton County Public Health's vaccination sites can be found on our website, which is hcph.org. You can see as a community, we've really done a great job of vaccinating everyone over the age of 40. We hit that national goal of 70%. And we've even gone above for that regional goal. We've hit everyone over the age of 60%. We've hit that 80% goal. So we've made a lot of impact. We continue to bring vaccines to churches and schools and locations where we know individuals are available, may be interested in getting vaccinated. Our goal is really to bring our vaccine campaign back to the community. And the last slide I have for you today is just a reminder that if you're looking for any type of testing or vaccinations, you can go to testprotectcincy.com and find those up-to-date informations that's supported by Hamilton County. So I really appreciate the commissioners funding this website. It's been a great one-stop shop for our community to go find access to testing and vaccine. If you have somebody in your family that is homebound and you would like Hamilton County Public Health to come to you, there's a phone number, 946-7800, and you choose option 6, where we will actually come out and schedule an appointment so that you can get vaccinated in your home. So I would encourage folks who need the vaccine to take advantage of that. And with that, I will turn it back over to you, Commissioner.
Great. Thank you, Greg, Commissioner. I really appreciate that. All right, we're going to go straight over to Renee Mahaffey-Harris, again, President and CEO of Closing the Health Gap. Welcome, Renee. Good morning.
Good morning, and thank you. I decided not to show slides. I'm going to talk from a report that we gave to the county commissioners a couple of weeks ago, in which we surveyed about 168 people across the Hamilton County region. And what we learned from that group through both of the survey completion as well as qualitative conversations that we had both as groups and as individuals, that 47% of that 168 still were not vaccinated. We started looking back at when we started this pandemic, and this pandemic began in our community. And what we saw as a somewhat a little bit disturbing trend, but maybe one that we all still understand, is that there still remains to be this hesitancy, or I don't even know if it's hesitancy anymore, questions and questions that cause people to wonder why they need to take the vaccine. One of the things that I saw highlighted in a New York Times article, Sunday New York Times, a couple of weeks ago, was the rollout in the conversation of Omicron. When that announcement happened, it talked about this alarming rate of people who were vaccinated getting COVID. And so people who were not vaccinated, as this survey has told us, started asking the question, well, why should I get the vaccine? Why that conversation becomes more disturbing for our community is that our kids getting vaccinated are the biggest key to how we address this state of COVID cases in our country and in our community. Our data went on to say that of the 47% who would not get vaccinated, and of course there was a percentage of people that were getting vaccinated, that 81% of all of those participating in the survey said that they were not likely to get their children vaccinated. So without a slide, hopefully you're following me in the conversation. So where our focus is making sure that we continue the conversation, that what we know works best is testimonials and conversations from people who have been vaccinated. Teens had stepped up with us and with this community to say, hey, I decided to get the vaccine for X reason. Many of those reasons were about continuing their athletic season. Some of those reasons had more to do with wanting to be able to be with their friends safely. And so taking a tone like from the kids and really trying to understand what we need to do differently in our community, I'm going to share a quote from one of our unvaccinated respondents that kind of confirms some of what I'm sharing. And obviously, what I'm talking about can be found on COVID-19communityresources.com, where you can see the full report. But this quote from one of our respondents in our survey said, it's not like the typical vaccine. It feels like there's a lot of manipulation in the public regarding it. The first person that got the vaccine on TV was a Black nurse. The manipulation had started then. So that was an interesting statement and a word that came out in this work that we didn't expect to hear. So the fact that it was perceived to be manipulation in a person's eyes because this is new, all the things that were happening in the media, but the fact that that word manipulation is out here tells us that it's going to be one-on-one conversations. It's going to be one-on-one activation points that cause people to say, hey, it's time for me to get the vaccine. And what's more urgent is parents who are vaccinated being able to make the decision to allow their children to get vaccinated. And I see Commissioner Kesterman shaking his head. You know, that's where we are going to be focused. We're also going to be focused on a disturbing statistic that we have learned from some of our hospital systems, in that pregnant moms who are representative of the marginalized populations that we serve at Closing the Health Gap are not getting vaccinated. What I have been able to do is, yesterday I got a text from one of the physicians at one of our area hospitals, and he said, I've identified 2 moms who are vaccinated who are willing to tell their story as to why they got vaccinated. I know we've talked a lot about misinformation. And so this information challenge, when there are data points coming from our health commissioners like Commissioner Kesterman and Dr. Fauci and our country and our experts, but then on social media, I call them social media doctors. People are sharing their perception, which might be based on a piece of a text or a piece of a social media statement, and they use that to share that one piece, and that negates all the data or all the facts that have been shared. And so we are going to continue to identify people who have been vaccinated and who want to tell their story, because it's those stories and it's that one-on-one conversation that is causing people to make the change to get vaccinated. I'm hopeful, and I know that we will continue to see those numbers increase from the data that Commissioner Kesterman shared. But we must simplify the conversation and the explanation about the vaccine. It's not enough to say that the vaccine is safe. These are some of our recommendations. Unvaccinated respondents want to be reassured with facts that they are willing to hear, and it relates to them. And so the best way to do that is for it to be relatable through someone that either looks like you, is your age, or is in the similar circumstance as you. We know that skepticism exists, but the more we tell the story, the more we use storytelling and testimonials, the more likely we are to move the needle. Even when we did our survey, of that 47% that weren't vaccinated, 24% of those folks said, I'm going to get the vaccination. And we did follow up with them and they did get the vaccine. So once they had conversations with people who were like-minded, or even some of their questions, they were in a setting where other people had similar questions, but then they could collectively say, you know what, it's better for me to take the step to get the vaccine than to not have the vaccine. Because what we do know from the facts is that over 90% of the people that have been hospitalized and those who have unfortunately passed were not vaccinated. So that is a fact. And so I am very encouraged, and I think the leadership of our county commission, Commissioner Driehaus and Commissioner Dumas Summerall and Commissioner Reese, and our health commissioner, both in Hamilton County and the city of Cincinnati, for the work that their teams are doing. One of the biggest challenges or conversations that I've had to have with many people, this is just around testing and even vaccine access. We all have to be patient and give each other grace right now, because we have staffing issues because of early on, in the last month or so, seeing the rates of COVID for our staff. And I said, we can't assume that everything affects all of us. So let's just be patient and continue to encourage and share why we got the vaccine, what we need to continue to do. I'm so excited about the Super Bowl and Who Day, but as Commissioner Kesterman said, if you're not feeling well, don't go to the party. Don't go out with everybody else. Stay in front of your TV and celebrate and root on our Bengals. So I know together we will continue to move the needle and work to save us all.
Yeah, thank you, Renee. I neglected to say that the county and the Center for Closing the Health Gap partnered early on to try to better understand all the dynamics that you just talked about and some of the hesitancies, so that we could provide information in a way that people want to receive the information to help them get to the point where they felt comfortable getting vaccinated. So thank you for the work of yourself and your team. It's been really, really helpful. All right, Bridget, I think it's time to go to questions.
Thanks, Commissioner. Up first, we have Mariel Carbone from WCPO.
Good morning.
Good morning. And I know we all got to say the Who Day, right? We're excited. I have a couple questions for Greg, kind of around Super Bowl. I'm wondering if you have any idea just how we compare to LA for all of our people that are traveling out that way. Do you have any idea how COVID looks out there and what they should expect traveling out there?
Unfortunately, I actually don't have any case numbers or anything to compare us with LA, but I would guess that COVID is still just as prevalent in their community as it is here. The general rules of thumb, Renee just re-mentioned it. If you feel sick, stay home. And I know that hurts if you bought a ticket, but I'm sure there's somebody that would be happy to have your ticket. If you're feeling ill, don't go to those parties. When you're in crowded locations, we encourage folks to wear masks. I still wear a mask when I'm in a grocery store and places I'm around others. I think those are the types of things that we're really asking for folks to do this Sunday as they're celebrating the Super Bowl.
And I know I heard I seen something, it was an article trending, I think on one of the social medias, but basically saying, if we're able to hold a giant Super Bowl with all these people, clearly the pandemic is over. What's the response to that? Because, we're seeing tens and thousands of people in the stadium for this.
So obviously, public health experts and scientists are learning every day about this pandemic and the newest wave of Omicron and how it has impacted our community. We know that just a month ago, we had more cases than we've had at any other moment in time during the pandemic. We also know that a large portion of our community, really our nation, have gotten sick from Omicron. And so it is possible that there is some immunity that we as a community have built up, both from the vaccine as well as from individuals getting sick. So hopefully we won't see any major spikes in the aftermath of the Super Bowl. The only thing we're hoping for is a win here locally.
And my last question for you, I think it was probably, I guess, 2 or 3 weeks ago, the last time you were asked this about the first playoff game. Was there a spike here locally? Did you hear of any outbreaks? Now that we're another game past, have we heard anything from the last championship game?
We certainly did. Yeah, we certainly did not see any specific increases associated with the playoff games, which is excellent news. We're very hopeful that will materialize again with the Super Bowl. Our team continues to investigate a variety of outbreaks, none of which we have linked back to Super Bowl or playoff activities. But there are lots of businesses where one person shows up sick and all of a sudden 12 people are sick in the same work area. And so we're finding that over and over again. I have a team of about 12 people that are helping our office just on outbreaks within our community and our businesses.
All right. Thank you.
Thanks, Muriel.
Up, we have Morella Porter from Local 12.
Hi, good
Morning.
morning. Can you hear me okay?
Yep.
Okay, you kind of touched on it a little bit with the Super Bowl. So is there anything else that you want to add when it comes to celebrating? Obviously, this is a super exciting time. I know that you've said multiple times, stay home if you're sick. So aside from maybe wearing a mask if you're, in public crowded settings, anything else that people should do or any concerns that you have when it comes to the Super Bowl celebration?
I just want people to be safe. And really the public health message right now is we're trying to keep it simple and we're trying to tell folks, keep sick at home, wear a mask when you're in public. And I think Renee also shared it. I mean, we want us to be kind to one another. It's been a long 2 years for our community. This is a great opportunity for us to share some success, and let's work together as a community one more time.
Okay, perfect. Thank you so much.
Thank you.
Okay, next we have Brooks Sutherland from the Inquirer.
Good morning, Brooks.
Hey, good morning, everyone. We obviously have Ohio National Guard members assisting with hospitals and, testing sites right now. We've seen in other areas of the state when things get better, they obviously get dismissed as they're no longer needed as much. Do we have an idea, commissioners, on where we're at, if the National Guard will be here for a little while longer, or if there's a set day of when they might be dismissed?
So the major operation right now that they're helping support is testing. And in my slides, I showed a slide that actually shows a significant decrease in the demand for testing. That said, the National Guard has committed to stick around another week after the Super Bowl, just in case we see any types of increases. We want to make sure that we have capacity here in Hamilton County. And obviously our community was very welcoming to have that additional assistance.
Yeah, we were on a call yesterday with the hospital, the heads of the hospitals and the mayor talking about this very thing about the National Guard and their presence here. So it's generous of them I think they just want to watch the Super Bowl in Cincinnati. I mean, who wouldn't? So they're sticking around for another week, but I hope we don't see a spike after Super Bowl, but they have been gracious to say that they'll hang around another week for us.
And just to clarify, you said that the testing sites, they would stick around for long. Is that the same with the hospitals, the guardsmen that are helping hospitals out?
I believe that demand is starting to decrease, but they are still present.
Great.
Okay, thank you.
Thank you.
Looks like we have one more question from a number 1120189. You're allowed to talk on our end if you just unmute.
There we go. Sorry about it's Matt Reese at 700 WLW. I'm sorry. I just kind of jumped on this. My apologies and good morning. I just had a question. We've watched these numbers drop 50% in 1 week. Have we seen this kind of a drop in the pandemic so far? 50% with these numbers? It's great news, but maybe you could elaborate on that a little bit and exactly why it's happened. And we're wondering, hey, are we almost finished with this? If you could let us know.
So at a high level, Matt, we have never seen our COVID numbers or hospitalizations drop at the rate that they have dropped over the last 2 weeks. And that is fantastic news for our community and quite frankly, for our nation. What we have learned throughout the pandemic is each variant kind of comes with its own set of illnesses and own specialties. And Omicron really came at us quick. It spread quicker than pretty much any other infectious disease. Luckily, it in many cases was not as severe, and its length of illness was shortened. And for these reasons, the nation kind of reacted. We shortened the mask requirements, we shortened the quarantine and isolation requirements, and we've kind of been able to enjoy a little bit more relief from COVID than we have during a few of the other variants. We're still watching very closely, and we're hopeful that maybe this will be a long period of time where we are not constantly being impacted by COVID-19. So we're keeping our fingers crossed and watching the data closely.
Thank you.
Yeah, just to elaborate just a little bit, this week over week analysis shows, each week we cut in half about the number of positive cases in Hamilton County. And so while a few weeks ago, the week over week increase was about 17,000. Then it was the next week, it was 8, then it was 5, now it's 2,100. You can see the trajectory here. We're about halving it each time we go. So that's something of note, obviously, and very good information and positive information. But the hospitalizations and the death count we are not seeing that with the death count, and it's a lagging indicator. But the week over week increase was 31 from last week. That's still a pretty high number. So yeah, I think it's the trajectory of positive cases is down, but we're still not out of the woods here when it comes to those that are going into the hospital, into the ICU then, and passing away from COVID. So it's because the Omicron cases the number is so much higher that, we're seeing these higher numbers still in the hospitals and in the death count, even though it is not as likely to land you in the hospital. There's so many more people getting it that a lot of people are still landing in the hospital.
No more questions from reporters.
All right. Predictably, a lot of them were about the Super Bowl game. So I think we're very distracted in a very positive way with the Super Bowl and the Bengals. So thank you again, Renee Mahaffey Harris, for joining. Thanks again, Greg Custerman, for joining. Really appreciate the insight and the expertise that you bring to the conversation. As far as when we're going to next have a briefing, we've always said we'll do these as needed. So we may or may not be back next week, but we will be in touch as we continue down this path of COVID-19 in our community. Thank you.
Thank you. Hoo day.
Good day.